Hello everyone, for Monday Motivation, I want to talk about positivity, but toxic positivity. So you have heard already what is toxic positivity? Oh no, not yet? Okay, I will let me explain. So we are all doing it a lot of the time. We are all victim and we are all, we can be all held accountable for spreading toxic positivity. And how do we do that? Very simple, easy peasy. Let's take up the examples. So the first example, your child is crying, he's hurt, he's feeling angry, and you say, oh, nothing happened, it's okay, you don't have to cry. Okay, one example, we will come back to it. Second one, your friend came to you sad, wants to express something and say, you're just making up things in your mind. Let's go shopping. You'll feel better. Second example. Let's take another example and I will explain how all these are examples of toxic positivity. Third one, somebody wants to tell you something or how bad they're feeling, especially with the doctors. Okay, and doctors do that a lot. Patient says, I feel a lot of pain. Oh no, you are completely fine, you're okay, it's just you have to walk, you have to do this, and they dismiss their concerns or their feelings. So toxic positivity involves a lot of dismissal of somebody's concerns, somebody's pain, feelings, and you teach them how to ignore or avoid your own negative emotions. So over the time we see everyone is doing that. So when we want to talk to someone, oh, you're fine, you're okay, just making things in your head, everything will be okay, you are fine, don't worry, and people just cut the connection off. There's no more connection. Somebody wants to talk, share, you just cut the connection off with your positive thing. So the intention of this kind of positivity is never bad. So the intention, I'm not doubting, nobody's doubting, the intention is always good. However, the effects or consequences are not. What do we learn out of this kind of positivity? Is to suppress, repress our own emotions, avoid our own negative emotions. We avoid even feeling that kind of emotion. We don't want to even address that what's happening inside, because we don't want to deal with them, we don't want to tackle, we don't want to feel those kind of emotions. We always want to feel so positive, and you just run away. I will be happy, I will be fine, I'm just fine, I'm just okay. So what is a sign that you're feeling a toxic positivity? When you push yourself, when you force that positivity on yourself, but your inside is saying something else. So whenever there is a conflict between outer and inside emotion, that you're forcing something positive on you and your inside is rejecting that, hey, no, there's something deeper inside, there's something cooking up and you need to address that. So what's happening inside, you have to deal with that. And nobody tells us that to address emotions in the right manner. We have never heard about it, we have never learned it, we have never seen growing it. So nowadays you see everyone talking about emotional health and mental health, and people still diss it, people are still dismiss it. It's like, the more you will think, the more you will talk, and the more you will get a disease. It's like you will go to a practitioner and you will diagnose yourself with one or two disorders, but it's not like you will go to them to get a disorder. It's just that you will figure out that there is a problem once you visit, or you say, something is not okay, I need to get checked, what's happening with me, what's happening inside. And second is, how can I deal with this kind of situation, this kind of emotion, what should I do? So once we see, like if we go back to the three situations. So in the first situation, when a child says, he's crying, he's angry, he's expressing emotions, and then you say, everything is okay, don't cry. So you dismiss his emotion or her emotion and you tell them crying is not okay, you're fine. So you build that kind of avoidance, or you teach them to avoid their own negative emotions and not address them in a healthy way. Second example I took was from a friend. because I always say the intention is never bad. Intention of this kind of positivity is never bad, but the consequence is. So you break the connection when somebody is sharing something with you, wants to share how they feel, and you just tell them, it's not normal, it's not natural, what you are feeling, you're just making it up, and let's go out. So like going out is okay because you're telling them an option how to deal with it, but dismissing their feeling is not okay. And the third, I saw, you will see a lot with the doctors telling you that, whenever you had an operation or something, you'll be fine, you need to walk, you need to do this. Not all, but most of the doctors, I see a lot of that kind of, positivity, that the intention is good, but the consequence is not. So I will come back again to the topic that what can we do with it. So what effects it causes. So once you notice this toxic positivity, you are doing it or somebody else doing it to you, it's not intentional. we agree to that part, that's not intentional, and we are just trying to find our ways and to deal with the emotions because nobody taught us how to do it. And what can you do about it now? Once you figure out that, okay, there is a conflict inside, this is not how I feel this kind of emotion and I'm avoiding that emotion. So, the emotion is there inside of you. So if you avoid it and if you keep it inside, it will come out in some other way. It will show in your work, it will show in your relationships, it will affect you in different aspects of your life. And how can we deal with our emotions? The simplest and easiest way is to let it pass. Let it go through, feel the feeling, let the emotion come and let it pass. It's a very simple aspect of mindfulness that you feel the feeling, you let the emotion pass. And then when you acknowledge that, okay, this is the emotion I'm feeling, this is the feeling that I have, this is how I felt, and now what can I do? So instead of in the first step where you avoid it, you neglect it, you do not accept it, and then you directly jump on, I would say, distracting behavior where you are jumping on another thing. So the behavior to going towards other options is okay, but first deal with the emotion, that you go and deal with what's happening inside, with what's happening to the person inside of you, and what he or she is feeling inside. Once you do that, once you deal with this, then jump on the positive thing. Then say, okay, I want to be positive, I want to feel positive. Deal with your emotions first before jumping on the distraction mechanism directly, before you switch on to the distraction mechanism. Take care. Bye.